Thank you for being here today. Welcome, everyone. My name is Sabrina Mayhew, and I'm a certified oncology nurse navigator, and I work at breastcancertrials.org, which is a program of Quantum Leap Healthcare Collaborative to improve education and access to clinical trials. And today we are here partnering with Share. We're going to focus on clinical trials. We're going to talk a little bit about the disparities that still exist in breast cancer research and care and what we can do about them. And even with all the progress in cancer research, we're going to talk a little bit about why everyone is not equally included in that progress. I'd like to take a moment first to introduce you to breastcancertrials.org. We are a nonprofit, free, patient-centered service created to help people with breast cancer or those who are at risk easily find clinical trials that are right for them. We know that clinical trials can offer access to new treatments, but navigating the process of finding the right trial can be confusing and overwhelming, and that's where we come in. And our mission is to make this process easier and more accessible. So we're going to start with talking a little bit about disparities in outcomes. Breast cancer affects people of all races and backgrounds, but not in the same way. Black and Hispanic women are more likely to be diagnosed at younger ages and with more aggressive types like triple negative breast cancer. And Black women have 40% higher chance of dying from breast cancer than their white counterparts. These differences are influenced by a combination of factors, and understanding these disparities is essential if we want to improve outcomes for all patients. Disparities are caused by more than one factor, and it's not just about individual behavior. It's about patterns that are built into our neighborhoods, our systems. Access to care and outcomes can be shaped by multiple overlapping factors. Tumor biology, more aggressive subtypes like triple negative breast cancer or unique genetic variants are more aggressive and harder to treat. Triple negative breast cancer is more common in Black women and younger patients. And certain groups may have different genetic changes in their tumors that affects how the cancer grows and responds to treatment. Structural racism means unfair systems in society like redlining that kept Black and minority communities separated and under-resourced. Social determinants such as income, insurance coverage, transportation, stress from difficult life situations can also hurt overall health and affect access to screening or recognizing systems, and delays in treatment. Many minority patients often face delays in diagnosis and sometimes get less aggressive care. And then there's bias in healthcare, and poor communication can also make patients lose trust or stop following treatment plans. Only 10% of adults with cancer participate in clinical trials at all. And among those who do, less than 3 to 5% are from underrepresented racial and ethnic groups. So to put this in context, Black Americans make up about 13% of the US population, but only account for 5% of clinical trial participants. Latino individuals represent about 19% of the population, but make up just about 1% of participants in trials. And what happens when people from diverse backgrounds aren't included in research? We see differences in how people respond to treatment, and we see more side effects, and we see worse outcomes. So these statistics reflect a larger system that has left many behind. And when we talk about underrepresented groups, we're commonly talking about racial and ethnic minorities who face barriers to participation, but there's also individuals who have lack of access to healthcare due to socioeconomic factors, and women who live in rural areas or those from the LGBTQ plus community may also be underrepresented, and these disparities can lead to gaps in understanding how new treatments affect diverse populations and ultimately impact the generalizability of research findings that can hinder the development of equitable healthcare solutions for all. So it's just important to remember that every medication we take, from Tylenol to targeted breast cancer therapies, starts in a clinical trial. And this is where researchers first learn if the drug is safe, how it works, and who it helps. So we're really talking about the backbone of modern medicine. Every medicine in your cabinet went through this process to prove that it's safe and effective. And I think thinking about it like this helps normalize the idea that participating in a clinical trial is not a last resort. It's just a standard way of how we move healthcare forward. It's important to remember that when we talk about breast cancer, every treatment that we use today, whether it's chemotherapy, immunotherapy, or targeted therapies, started with someone saying yes to a clinical trial. They drive every major advance in breast cancer treatment, and without trials, these treatments wouldn't exist. And if you ever attend any of the big cancer conferences like ASCO in Chicago or San Antonio, you will see that research is creating better outcomes for cancer patients, and people are living longer and better. And at least for me as a cancer survivor, that's very reassuring. However, one of the biggest challenges that we face in cancer research is that not everyone is equally represented. And this means that many studies don't include enough people of color or older adults or people from different communities and backgrounds. And that's a big problem because people's bodies, again, can respond differently to treatment based on genetics, lifestyle, environment, and access to care. And if trials only include one type of person, we may not have good information about how well the treatment works for others or what sort of side effects they may face. And so we risk creating treatments when we don't have diverse representation that are not safe or may not be effective for everyone. So diversity in trials isn't just about fairness, it's about better science, and it helps make us make sure that every person has the best chance at the best care. There are many reasons why clinical trials often don't reflect the full range of people affected by cancer. And one of the biggest reasons is many people simply aren't told about trials. If their doctor doesn't mention it, a patient may never know it is an option. And there are lots of reasons why doctors don't always talk about clinical trials. There are barriers in time when they're seeing patients. There are challenges if a patient has to leave the healthcare system that they're being treated at and move to another hospital. Some people are also left out of trials because of strict rules about who can join. The rules may exclude people who are older or who have health problems. Even when someone is eligible, there are real life obstacles like missing work or paying for gas or childcare or not having insurance that covers related costs. Access is another issue. Many trials are only offered at big hospitals or research centers and not community clinics or rural areas. And then finally, mistrust continues to be a huge barrier. Some people are hesitate to join because of past historical injustices in medical research, or they don't see people like themselves represented in the process. So to change this, I think education is key. We need to meet people where they are and remove as many of these barriers as we can. When trials reflect the diversity of the whole population, the science is stronger and we get more accurate and reliable data on how treatments work across different groups, which leads to safer, more effective therapy for everyone and not just a select few. Some side effects might appear more frequently or severely in certain groups, and if those groups are missing from trials, we may not catch these issues early, and that puts patients at risk. So equity isn't just about numbers, it's about relationships. And trust is built when communities are meaningfully engaged, informed, and included in research process from the start. And it's not enough just to ask people to join a trial. We need to show that their participation and voice matter. Currently, we're at a critical moment. Funding cuts are targeting programs that specifically support diversity in breast cancer research. And these aren't just numbers on the budget sheet. These are programs that help make sure all communities are seen, heard, and studied. And when funding is pulled from research that looks at how breast cancer impacts different racial and ethnic groups, we lose vital information. And that means we won't fully understand how this disease behaves in all populations or how best to treat it. These cuts threaten the progress we've made in clinical trials, in making treatments more accessible and in supporting survivors. And without this research, the gaps in outcomes could grow wider, and we risk leaving behind the very people who already face the greatest barriers to care. So now is the time to double down on equity and inclusion in research. This lack of inclusion isn't just a short-term problem. Again, if we miss the chance to involve diverse groups in research today, it could take years, maybe decades, to correct those gaps. And for many, the damage may not be fixable. Breast cancer doesn't wait, and people are being diagnosed and making treatment decisions every day. That's why it matters so much. We just need to make sure that everyone, no matter their race, income, or zip code, has access to new treatments, clinical trials, and the chance to survive and thrive after breast cancer. Now that we have a few facts about why this is so important, one of the most powerful things you can do is talk. Talk to your friends, your family, your neighbors, your faith groups, local leaders. Share why research and equity matter. When people hear it from someone they know and trust, it makes a real impact. Also, our elected officials need to hear from us. They make decisions about funding for research and public health. Remind them that cutting research dollars isn't just a budget issue. It affects real lives in real time. Every email, call, or letter counts. Also, there's a lot of misinformation out there, especially online. We can help stop the spread of myths by staying up to date and sharing clear, trusted information with others. Be a reliable voice in your circle. And then this is all connected. Supporting breast cancer research means fighting for better treatments. And then supporting equity means that making sure everyone benefits from those treatments. And supporting each other means that no one has to face this alone. We all have a role to play, and together we can make change. And at breastcancertrials.org, we have been always dedicated to improving access to clinical trials and helping patients find the right trial for their unique diagnosis and situation. We have a platform that's designed for both patients and caregivers, and we engage in outreach to community and advocacy organizations to promote diverse inclusion in research. We have over 40 partnerships with trusted organizations, including organizations in underserved communities, to help share information, answer questions, and encourage trial participation from populations that are underrepresented. And basically, I would say that education is central. It's central to what we do. We try to help people understand what clinical trials are and why diverse representation matters, and any questions that they may have. Thanks so much for being with us today. We're happy to answer any questions that you may have about joining or finding a clinical trial. And if we always welcome feedback. And if you have any ideas or thoughts about how we can increase access and diversity in trials, we would love to hear from you. You can contact us or contact Share and give us your thoughts.